Good afternoon. We'll give a few minutes for everyone to log in before we start. Can everyone hear me okay? Any positive signs for audio?
Yes.
Great. All right, so it's been a minute, so I think we'll get started. I want to thank everyone for taking time out of their afternoon to join us for this virtual event discussing the new Preservé breast augmentation technique. So it's really kind of a new way of looking at and performing breast augmentation. We'll kind of talk about how it's done, why we do it this way, or why it might be a good option for you, kind of who's a good candidate for it, and kind of go through all those details. So my name is Dr. Daniel Butz. I'm a board-certified plastic surgeon. I really focus on breast and body aesthetics. I do, well over 100 breast augmentations every year, a lot of lifts, reductions as well, and then kind of more body contouring, mommy makeovers with drainless techniques, and a lot of weight loss surgeries as well. But today we're going to focus on breast augmentation. So there'll be an opportunity for questions at the end. You can kind of enter them, and we'll read them off as we go, or kind of at the end at least. I'll try to, we'll kind of we'll repeat a few things here over, so you hear it a couple times as well. And then at the end, there's also a raffle prize. So it's for everyone who's joined, stay to the end so you can take advantage of that and hopefully win that. And then there'll also be, if you weren't able to log in or whatnot, we'll be posting this on YouTube, and you'll get an email as well so you can rewatch it if you're so inclined. So, why is breast augmentation evolving? I think this is a really important part, is because breast augmentation in general has not changed all that much over the last really 20 or so years. For a long time, we were putting these implants below the muscle, often releasing or kind of cutting the muscle a little bit. And we did that to make the results look more natural, to kind of hide the implants more. And a lot of the earlier data suggested that this was had less issues with capsular contraction and things. Motiva kind of entered the field of breast augmentation kind of from a fresh place. They weren't taking 40-year-old devices and trying to use them for a 21st century patient. Looking at how can we make this this very popular procedure safer and more long-lasting with less issues. So they came up with a really great implant that has less chance of kind of visibility or rippling. So looking at this implant here, it's very little kind of rippling of the implant itself. So you don't need nearly as much coverage to hide this implant. So then we can go above the muscle in more patients, which is then less invasive, allows a more modern patient who's exercising, lifting weight, staying active, to do all those things with with less kind of impact of the implant or that animation. So I think that's kind of really been a game changer. And then this next step with the Preservé is looking at how can we preserve all the breast ligaments. So traditional techniques, we go in and we kind of cut and make a pocket, whether it's above or below, to make a kind of pocket for that implant. With Preservé, we kind of carefully kind of dissect through those ligaments and then gently kind of stretch them to make this pocket. So it's more kind of intertwined below the breast, but kind of within it in a sense. Again, making it look more natural, move with the breast and the body better. And then other big things is you're going to get a smoother recovery. So since we're not cutting anything, there's less bruising or swelling. So quicker recovery, smoother recovery. Again, we're preserving all the anatomy. So essentially 0% chance of sensation loss, which is great. Sometimes it's a little kind of twingy early on, but we're not cutting the nerves, so there shouldn't be any nipple sensation loss. Again, we're preserving all that breast tissue above, which is kind of common below if we do the other techniques as well. Again, utilizing these newer implants, better technology at the lowest risk of rupture rates, lowest risk of capsular contraction, to really provide not only good early results or easier recoveries, but also long-term results as well. And And again, this is designed for that more modern patient who's exercising, prioritizing recovery, and kind of getting back to their active lifestyles as well. So I think it's in a really kind of, Motiva in general has kind of shifted the field a little bit, and this Preservé technique is to the next level. So again, what is it? I kind of mentioned a few of this. So again, it's an innovative, minimally invasive approach. And it does rely on some older methods of kind of utilizing a deflated balloon to stretch, but using it in a different pocket to preserve all those ligaments. It's designed to preserve all the natural breast anatomy tissues, like I mentioned. Sensation loss essentially zero. In their study, they had zero bleeding issues or hematomas as well, which is really quite incredible with 5,000 patients. Again, minimizing disruption to the native breast structures, and that's all left intact, which is great. And we can do this through a smaller incision and a smoother recovery. And I don't think a 3 centimeter versus a 3.5 or 4 centimeters is like a game changer, but it does. Anything smaller is better. And certainly, some surgeons are using up to 5 centimeter, 6 centimeter incisions, so it's a big change from that. And then again, utilizing all your natural tissue, you have good soft tissue support, so we don't need to utilize internal bra meshes. We're preserving that natural ligaments, which are very strong and can hold up for a long time. Again, really focusing on that long-term breast stability preservation for long-term results, and really soft natural results as well. So again, how is it different? Again, traditional techniques were really focusing on just maximize volume. I think that's been a big trend shift as well. For years it was kind of higher volume implants, maxing things out, and it's kind of a different thought process. In the traditional way, we're often filling from the bottom of the breast up, which can sometimes make a kind of heavier lower bottom of the breast. Most patients want that upper pole fullness. So with Motiva Preservé, we're actually kind of filling from the top down, kind of preserving kind of more soft tissue around the implant, not cutting it, kind of helps provide more of that support. Into typical techniques, we're again using cautery devices to make that pocket versus using kind of a little bit less disruptive kind of stretching technique. In larger pockets are created really in traditional ways. We're trying to create a glove and fit pocket. We want that to fit the implant kind of perfectly, but because we're cutting those ligaments, over time it always is going to stretch a little bit, bigger than what we started with. So we want it quite tight. With Preservé, and we're not cutting anything, so all those ligaments are kind of bunched on top of each other, providing better coverage of that implant. Recovery can vary quite a bit with traditional. Again, below the muscle is a little bit longer. We don't want you using that chest muscle too much too soon, but above the muscle, subfascial, which is becoming more popular, is definitely quite a bit easier, but still same general guidelines: avoiding heavy lifting for 2 weeks, exercise for 5 to 6. If you're subfascial, you can get back to chest exercise pretty quickly. If you're below the muscle, I personally think you should wait at least 3 months. With Preservé, you can back to regular stuff in a couple of days and exercise as early as a week. But we want to be smart about it and kind of ease back into it, and don't go too strenuous right away. And traditionally, augmentation focus is just looking at volume. Preservé is really going to focus on your anatomy, really enhancing that. We talked about incisions a little bit, and then again, placement methods. Again, we talked about there's dual plane. Full muscle coverage isn't really utilized all that often anymore. The implants often tend to sit too high and be really tight. Dual plane, again, has been probably the mainstay for the last 20 some years, where you release the lower portion of the muscle, that's when if you activate the muscle and get that animation, which a lot of patients are not bothered by, and a lot of patients are still able to do full range of activity chest workouts. But for those that are bothered by it, it can really impede some of those things, and also kind of wants to push the implants to the side, which no one really likes. Preservé is a little bit, it's in this kind of retroglandular space above the fascia, below the breast tissue. There's kind of this little pocket there that we can take advantage of, where all those ligaments are holding the breast together. So who's a good candidate? Typically, this is best for primary augmentations, first time. Secondaries can be a little bit trickier to pick because things that the muscles kind of been distorted a little bit. In general, it's going to be better for if you're looking for more of a natural result, not trying to really stretch that tissue too much. In the active lifestyle, I think is really the big thing. Getting back to your whether it's taking care of kids or working out. There's really a much shorter kind of time frame to those kind of regular daily activities, and then more higher intensity things as well. And again, faster, quick recovery. You don't need general anesthetic. Some still are doing it under general, but you can use it under IV sedation. And for the right patient, even local is possible. But to be comfortable with, some a little bit more pressure. But which is again a nice benefit. Less anesthesia, less chance of nausea. Feeling sick from kind of those drugs. So it's kind of nice to be able to avoid that if you can. So how our consultation process typically works. Is it's a multi-step. Oftentimes, even before you meet me, you talk with a few people from our team. Kind of they understand what your goals are. We find a date. You come in. We again discuss your goals, your lifestyle, what you're looking for. We have wish picks and things to help kind of make sure we're on the same page with that. I can show you a lot of examples as well. Then we do an exam, and where we take measurements, look at your anatomy, and talk about what you might be able to expect compared to, say, some of those wish picks you brought in. And that's where we kind of determine if Preservé might be a good option for you. And that really comes down to tissue coverage. If it's really thin, maybe Preservé is not a good option. Not everyone's a great candidate for above the muscle, but I think a lot more patients are thanks to the newer implants. And then the implant volume you want. If you want bigger implants, Preservé is not going to be as reliable of an option. The highest size they recommend is 315, the full profile. But they do tend to look a lot bigger than 315, if you went below the muscle or even subfascial. So you do have to take that into consideration, because it's not, if you look at what your friend had in traditional fashion, it might look a lot different than that. Obviously, we go over questions, we talk about recovery, instructions, and we have a whole other visit focused on that post-op care and kind of being prepared for surgery to make sure we're really well prepared for that. And then after your kind of that consultation with me, we have you talk with one of the coordinators, Amanda, to discuss scheduling and all of that as well. They're kind of your point person for logistics and questions before surgery. So again, focus a little bit more on the technique here, how it actually is done, why is it different. We've kind of talked about a lot of this, preserving the breast tissue, not cutting the muscle, not really cutting anything, slightly smaller incisions, faster recovery, less downtime and discomfort, which is great. And again, full sensation, and then really natural results because of how it's done. And this utilizes the Motiva ergonomic implant, which is their slightly softer gel. Again, these have been shown to have some rupture rates, maybe just 1 to 2% at 10 years. Caps and traction rates less than 1%. They're very soft. They can move with your body really nicely. They're designed to be a little bit more of a teardrop shape, kind of the upper pole. Sorry, I'm pointing at my screen. You can't see that. Versus more upper pole fullness, but you still get nice upper pole fullness. It's just a little softer than the other gel type that's referred to as round. Again, I'll show you those in the office and see what make sense for you. Again, by preserving all those ligaments, there's really much less chance of things people often talk about, the implants lateralizing, falling to the side. Really preserving the ligament stays right within the breast tissue or the breast pocket. So I kind of alluded to this a little bit. Again, we typically start with the numbing to kind of make everything nice and numb. It also causes vasoconstriction of the blood vessels, so it really eliminates the risk of a bleeding issue afterwards. We let that sit for about 10 minutes, and then we use this channel separator device. We have a video to show you as well to kind of make that initial channel, and then this balloon dilator goes in to stretch that pocket right where we want it. We can position it a little bit higher, a little bit lower, depending on kind of where your breast needs more volume. Then we utilize a no-touch technique with this funnel to put the implants in, and that's pretty much it. So from the actual procedure itself might just take 10 to 15 minutes per side. But from the start of numbing to the end of the procedure, it's maybe more like 45 to 50 minutes, because we want to really wait a good 10 minutes to let things get fully numb. So this is a little video.
Preservé is a new approach to breast enhancement by working with your body's natural structure instead of cutting through it. By gently creating a space inside the breast, it securely supports the implant by preserving natural breast tissue and nipple sensation.
And all those nerves.
Whether you're considering your first augmentation or looking for a lift, Preservé patients will benefit from a less invasive technique.
It's that pocket kind of underneath. So that's that ligament that was referring to, a circummammary ligament.
Low inflammation,
kind of sticking the implant within that. So again,
the first step in Preservé is numbing the area, using a tumescent solution for 10 minutes.
Expand and create that space to start.
Your surgeon will use the Motiva channel separator via a small incision in the infrared fold, which is the crease under your breast,
general
to
channel
create
we're
a
going
tunnel
through
without cutting the tissue. This provides access to the space where your breast implant will live. Next, your surgeon will insert the Motiva
balloon. So we can
balloon
fill this
tube
up to
to
different
gradually
levels
push your
depending on the
tissue
size
structures
you're
to the
looking
side,
for, but again,
creating a precise pocket that
stretching those
matches the size of
ligaments
your
and
breast implant.
maintaining them, but just kind of creating a pocket
Finally,
within
your
it.
Motiva Smooth Silk Ergonomics implant will be inserted in the space that was created, preserving your natural breast tissue functionality, including nipple sensation and your chest muscles.
So that kind of just lets you see kind of how that works from start to finish. It is pretty incredible, how quickly things kind of start to kind of bounce back faster. Traditionally, we often talk about drop and fluff, and things are quite swollen. There's a lot less of that, but there's still obviously some swelling and some settling that needs to take place. So again, benefits, faster recovery. Again, most patients are pain meds for just a day or so, maybe none at all. But taking it pretty easy for those first 1 to 3 days for heavy lifting, then exercise 1 to 2 weeks, but again kind of reintroducing that a little quicker and less pain, less discomfort, which is great. A little smaller incisions, preserving all that natural tissue. We talked about sensation a number of times. We've kind of repeated this a few times. So in downtime, I mentioned again back to daily activities 1 to 2 days. Again, that first day you're maybe a little sore, but normally it's not too bad. Back to work, same kind of thing, 1 to 2 days. Less pain and downtime again. So I give you a narcotic pain pill, and the handful I've done so far, I've just taken like one of them the first night, then ibuprofen, Tylenol, and then maybe eventually we stop using those altogether. But I think it's nice to have just as a backup. You can exercise again. You can probably start some light leg stuff. You got a week and kind of just be careful. But normally say 2 weeks for kind of more strenuous things. But my big thing is always listening to your body, so it feels okay. It's probably fine. Wearing good support. Again, here's a couple. Again, this is kind of a newer things. We don't have a ton of good examples yet, but this patient's 3 months out now. Now she wanted a nice, full but natural result. And so this was just 215 cc's, and you can see again nice fullness, filling our swimsuits much better than she used to. She's really happy with the final volume. We talked about doing 285 in a traditional method, and we kind of went a little bit smaller for Preservé, and she's again glad we didn't go any bigger, but looked quite good at a week. Was already at the 3-week mark when we saw her already very soft and mobile. Things have kind of really looking really great at 3 months. So, some common questions we get, I think I mentioned, maybe answered a few of these, but biggest implant size is 315 in the full profile. It's all about kind of the width of the implant, and we kind of pick that based on your anatomy, your goals. Will it affect how you the ability to breastfeed? This doesn't really change, in my opinion, really, regardless if we're going subfascial, dual plane, retroglandular, the Preservé, we're not touching the breast tissue. So you should be able to breastfeed if you would like to. Again, the procedure length, start to finish, it might be about 45 minutes. But again, a lot of times we're kind of waiting a lot during that time to let that numbing take full effect. Can it be combined with the breast lift? Absolutely. And some of the big benefits of getting back to exercise, I think, might not be as big of a benefit, but you're still preserving those ligaments. The sensation is kind of the big thing. If it's a really big breast lift, maybe not as big of a benefit, but it can be combined with other surgeries for sure. And how long do they last? So the implants, again, this is a common question. They're not, a lot of times people talk about, have to be changed out every 10 years. That's not really true. The warranties often last 10 years, and a lot of the studies last 10 years. So that's kind of a lot of the numbers we have to work with. But these newer implants, again, with rupture rates being so low at 10 years, again, that's often the big thing that can occur. Other implant companies that was often as high as like 20%. Now it's more like 1%. These should at least last. My goal would be 15 to 20 years. But a lot of it depends on how your breast and body kind of age with them. So whether or not you lose more breast volume as you get older and you want bigger implants, or sometimes smaller, or you may need a lift over time, or kind of the probably bigger variables that might lead to a revision over the implant actually causing a problem, which I think is great. We want that implant to be safe, stable, long lasting, but your breast and body do continue to age with time. So let's see if we have any other questions.
Does the drop and fluff take as long with this method?
It's a little bit faster, largely due to, let's see here, largely due to the fact that we're tend to use smaller implants. Oftentimes, drop and fluff is, in my opinion, directly related to how big the implants are and how tight your skin is. So really big implants, tight skin, it's going to take longer for your skin and body to kind of adapt to them. If you're below the muscle, the implants often go really high because the muscle kind of gets tight and they slowly settle. If you're subfascial, they tend to go a little bit, more lateral, not quite as high. But so again, because we're tending to use smaller implants with this, it's going to kind of fluff faster for sure.
What does the timeline look like between consultation and scheduling?
So consultation and scheduling, that's a great Amanda question. Typically, probably average is probably between the consultation, if you're ready to book that day. Most of the time, maybe you can get on the schedule, maybe 6 to 8 weeks is probably typical. If, smaller cases like breast augmentations are often, just an hour, we can sometimes squeeze those in a little bit faster. If it's a larger combination surgery, with tummy tuck or kind of, say 3-4 hours, it might take a little bit longer to get on the schedule. But we also want to make sure we're, planning and have, you're well prepared for that surgery. So we have to get preoperative clearance and things like that as well. And typically, I think how far am I booked out? That can be seasonal. Like summer often gets a little bit slower. But so a few months ago it was almost 3 months. Now there's still some availability in August, but fall's getting kind of full. So if you're like, I really want that surgery in October, you kind of need to start planning a little bit more ahead. But again, if it's just an augmentation, we can often find time for those a little bit easier.
Are you doing these with mommy makeover procedures?
Yeah, absolutely. You can combine it with mommy makeover at the same time.
What Quintessa locations do you perform breast surgery at?
So the surgery itself is done at our Brookfield location. We have a full surgery center that's fully accredited, there. In our other locations, typically do kind of smaller in-office procedures. Even if I was doing this under like a local anesthetic, which again, can be done for some patients, I'd still want to do it in the kind of more sterile environment of the OR versus the office, where it's still quite sterile, but we don't have quite as many the tools we need in the OR.
Can the procedure still be done without general anesthesia if you need a lift as well?
It kind of depends on how big the lift is, because with the lift, we need to get more numbing to kind of numb all those areas that were, so more incisions are needed. So it kind of depends on how big the lift is, how complicated it might be. So it's possible with the more, kind of deeper IV sedation, but it might not, it's going to take longer, and kind of some of those variables may make more sense to do it under general.
Besides the actual implant, how does this differ from just a lift?
I'm not sure I totally understand. So, just a lift is just utilizing your tissue to reshape things. So, if you're really happy with so I kind of think about if you're happy with your volume in a sports bra, but you don't like the shape of your breast without kind of something supporting it, a lift can really be helpful to kind of reshape, tighten, kind of, get things lifted. The implant really provides more volume. It can be, very natural amount of volume, as small as 150 cc's, which is about a cup size, but really provide that upper pole fullness. And you kind of, it's all about trying to understand your goals and what's going to give you the result you're looking for. I'm not sure if that answers that question, but
some people are just tight. Yeah, we're just waiting on a couple people.
Yeah, again, the Preservé, versus an implant with a lift, the Preservé is again all trying to focus on preserving the internal breast architecture. If we're doing a more subfascial technique, again, I often utilize an internal bra mesh to help support that, since we're kind of cutting some of those ligaments.
Is a consult done in Milwaukee as well, or can it be done in Madison?
So I don't go to Madison. Dr. Thayer does, though, and he will be offering this as well. We do offer virtual consults, which can be a little bit easier with these. I've had some patients for Preservé that are in Green Bay, and I didn't meet her until the day of the surgery, which I think it's always nice to try incisors and kind of have more time with that. But if logistics don't make sense, it can be done. A lot of that can be done virtually.
What is the cost difference from traditional augmentation procedures?
It's definitely a little bit more, because there's kind of this, single-use kit that's a part of it. So it's kind of an added cost. but I don't know the exact numbers. Amanda, one of the coordinators, will provide that quote to you. So you can certainly get a quote for Preservé versus traditional, but it is a little bit more for sure.
How soon can someone get back to exercise after this technique?
I mean, light stuff, it could be as early as a week. And I think you want to be careful between 1 to 2 weeks and kind of ease back into it. Obviously, if you're combining it with a breast lift or a tummy tuck, that's going to maybe hold you back a little bit more. But it can be a lot faster, which is one of the big benefits.
Just got a couple people typing. If 315 cc is the max size, what range cup size might this result in?
So the general rule of thumb is 150 cc's is about a cup size, and that's with traditional methods. So again, with Preservé, it normally looks a fair amount larger, which again, I think is kind of great if you can get a bigger kind of impact per cc. The less amount of weight you need to add to the breast, I think is going to be longer lasting. So 315 is probably at least bare minimum 2, maybe 2.5, and maybe up to 3 cup sizes depending on your base anatomy. If you're 5'10" and heavier, you might need more volume per cc per cup size, versus a smaller individual is going to kind of get more cup size out of that same volume. So it really kind of comes down to your anatomy and what you're looking for.
What are the implants filled with to give it that natural feel?
So it's a cohesive silicone gel. There's different kind of ways in how they cross-link it to give it more stability. In some of these older implants, again, there's less cross-linking, which would kind of lead to more of this potential rippling. So again, a lot of the companies have come up with better gel types to create more of this kind of more cohesive result. But they also fill the implant a little bit more fully. So again, this is an older implant. This doesn't totally show it, but it often kind of creates a little more flat kind of on the top. It's not filled at say 100%, versus this one kind of you can see kind of a little bit more of that projection. Which again decreases the amount of potential rippling, which I think is great.
If I have a traditional breast augmentation, can I switch to Preservé when I decide to exchange?
It's probably not as beneficial. If you have, let's say you're below the muscle, a lot of times we are converting the subfascial and we put the muscle back in the position and then kind of create that new pocket. So it would have to kind of assess kind of case by case, depending on how much, how much the muscle's been released and how much of those natural ligaments are still preserved. If they've been released or altered too much, it might not make sense to try to force this technique, but rely on still true and tried methods with subfascial and meshes and things like that.
If you have a breast lift and you lose weight and tighten breast muscle or area muscles, will this interfere with a breast lift? That's how it's
Where's that
checked
question?
out. It's in questions.
Can you repeat that? If you have a breast lift
and you lose weight and tighten breast area muscles, will this interfere with the breast lift?
But you've already had a lift? Or which one is it? Trying to understand. Oh, questions down there. So I guess if you sorry, not totally following the question. So if you're doing a breast lift because you've lost weight, for example, your muscles don't typically, building your chest muscles don't typically give you a lot of breast volume. It's not going to fill that out. So I'm not sure if that's referring to that. Shouldn't interfere. If you've had a breast lift and you've lost weight and you need to revise it, that's again not an all that uncommon scenario where we need to tighten things back up. Normally, I wouldn't be overly concerned about, again, working the chest muscles. If we're using that Preservé and you've had a previous breast lift, that's, again, normally, it depends on how they did the breast lift. There's some breast lift techniques that are kind of, more sparing of the actual breast tissue versus others utilizing kind of auto augmentation, these things to cut those ligaments a little bit differently. So, again, it's a little bit more kind of case by case.
We have someone typing. That'll be the last question. Or just waiting for the answer, or just wait for the question. Do I need to be done breastfeeding before augmentation?
I mean, absolutely. If you're actively breastfeeding, you want to normally wait about 3 months, let your breast volume kind of get back to baseline before considering or kind of finding your final size and things like that. if you're kind of in between children and going to potentially breastfeed again in the future, I think that's okay. Again, if it's like going to be done in, if you're like thinking about it in 6 months to a year, maybe it's better to wait, because again, that can create a lot of variables, a lot more potential changes. But if it's like in the 5-year, 10-year kind of distance, I think it's totally fine to do this beforehand. And again, the vast majority of the time, you're still able to breastfeed afterwards.
All right, well, that was all the questions for today.
Awesome. Well, thank you for attending. And if other questions come up, I'm pretty active responding to messages on Instagram if you want to shoot me a DM. Otherwise, reach out and set up a consultation, and we can meet and kind of find out what that right size might be for you. If you call, I think they also might have better price estimates. I just don't really know those numbers off the top of my head. And then the
Raffle winner will be announced tonight on the Quintessa page at 6 p.m.
Perfect. Well, thank you all, and hopefully you found this useful.